We are glad to welcome today Dr. Kent Price. Dr. Kent Price is with Eyesight Associates. They have offices and clinics in Warner Robins, and thank goodness they also have one here in Cordele. Dr. Price, what a joy to have you with us today.
Good to be here.
I was trying to read your card, ophthalmologist.
Ophthalmologist.
How long did you have to go to school? Forever?
4 years of college, 4 years of medical school, and then 4 years of just ophthalmology.
Wow. So 12 years.
12-year package, right.
You knew that going in.
Right.
Why did you choose ophthalmology as
ophthalmology
specialty?
combines a lot of things for me. I mean, why did I get into medicine? Start there.
Yeah.
I got into medicine because I like people and I like science, and my father was a pharmacist,
Okay.
so I thought.
So you had an entree to that. Yeah.
Right, that was a place for me. And then you get into medical school and you're not really sure what you want to do, and then you see the different arenas, and I was asked to assist in an eye surgery once, and it was love at first sight. No pun intended.
You knew what you wanted to do.
I knew what I wanted to do, and ophthalmology is such a great profession because I can take someone who's blind and allow them to see. I mean, just this past week,
Wow.
I've had patients that I did cataract surgery on last week, and now they're seeing 20/20. Without
Do they
glasses.
kiss you? They want to kiss you on the mouth?
Well, these were gentlemen. Yeah, no, they don't want to kiss me. They're not there yet. But
a hug would be okay.
Yeah, good handshake.
That must be so rewarding. They come back and say, "Hey, I can see."
Yeah. That's why I do. I mean, that's the reward. I mean, you talk about different endeavors in medicine. There's very few things in medicine where the physician can make a person better than what they ever have been.
Gosh.
You can get a new hip. And you can walk, you can get a new knee, but you're never going to be a track star.
Right.
Now I do cataract surgery on someone who's 65, 70, 75 years old, and they're actually going to see better than when they were 20.
Is that right? Because they told me that
blessing.
They told me I had beginning of cataracts, and they're going to have to have it removed. I said, when? I'm thinking like next week. He said, probably 10 years. I said, oh, well, I'm like Scarlett O'Hara. I'll think about that tomorrow.
That's right. Don't worry about it.
How do you do cataract surgery?
Well, when you think of cataract, think of a opacity, a dirty window inside the eye, a dirty lens inside the eye. Mm-hmm. And so what one does, you make a small incision and you go in and you can think of the cataract. The cataract has a consistency somewhere between Jell-O and a rock, depending on the person. Sometimes you'll do cataract surgery and it's a soft gel, and it's just a matter of removing it, aspirating it out. Suck it out. Yeah. Other times, though, it's rock-like, and you have to go in there. We have a special device that breaks up that cataract, and then as it emulsifies it, it sucks it out.
Now, do you use something like ultrasonic sound?
Exactly, yeah. The phaco emulsification handpiece, it kind of looks like the tip of a ballpoint pen. It vibrates about 40,000 times a second.
Now, in the old days, you actually went in with a scalpel, didn't you?
Right. In the old days, you would make a large incision, and you would take that rock out in one piece. And then you had a nice little trophy that you could show all your friends. Yeah. Here's my cataract.
And I remember people years ago having it done and having to be almost immobile for several days.
Right, because you make the very large incision, and back then the sutures to close that wound were not very good. It was not very secure. So if you closed the wound and then the person went out and just did normal everyday activity, that wound could break open and you could lose the eye.
And now it's changed so much.
Right. Well, now we don't even use stitches anymore.
Okay. Is there something else on the horizon they're doing R&D on right now that may even be science fiction beyond this?
The latest, greatest, and I'm very fortunate to be a part of Eyesight Associates, is a laser-based incisions and laser-based cataract surgery.
Wow.
We just talked about the phaco handpiece that acts like a miniature jackhammer.
Right.
And that uses a sound wave to break up the cataract. Now, brand new, we have a laser that breaks up the cataract. So the laser makes the incisions, the laser makes the opening in the shell that holds the cataract, the laser emulsifies the cataract, so it's much safer. Okay,
I'm one of those convulsive blinkers. You start messing around my eye, like that. How do you deal with that when you're getting ready to do that surgery, Dr. Price?
Starts with an IV, so we give you plenty of medicine to keep you happy, keep you sedated, and then we have an eyelid holder that holds the eyelid open, so even if you wanted to, you couldn't.
You can't do it, okay.
And then we numb the eye with drops and with different medications so that you don't feel anything, so you have no reason to want to blink.
Yeah, one time I was going to put I would put contacts in. It was
not for
I
you.
Forgot they couldn't do it.
Right.
That's
right.
why I don't wear glasses.
Right.
I had 3 or 4 pair of them, and, but I'm comfortable with that. It's not a problem.
Well, we can fix that with another laser if you're ever inclined.
Okay.
Yeah.
I've heard about that.
Yeah. Laser vision correction.
Okay, and I can see pretty good up close. The farther away it gets, the worse it gets.
You're nearsighted. So there are 2 lenses. The internal lens is where the cataract lies. The external lens is the cornea.
I'm looking at you. You look. I can see you great. I can read your badge. I can do the whole thing. But now if you back off over in the studio, 15, 20 feet,
So what we use is an excimer laser to reshape this front lens, the cornea, and that would correct your nearsightedness. So what you would do, we do laser vision correction on one eye for distance. We leave your other eye nearsighted, and that's called monovision. So you would be able to see, to drive with your right eye and read with your left eye. So you would never wear glasses.
Wow.
Right.
That would be nice.
Or I should never say never, but most of the time, probably 12 hours, 14 hours a day, you wouldn't need glasses.
What's the youngest person that you've had do cataract surgery on? You say it's in the 50, 60, 70 range.
Typically.
But does it sometimes occur in the younger population?
My youngest is 19.
Wow, how did he or she develop that?
No history of trauma, no history of drug use. Certain drugs can cause cataracts to form. No history of welding or glass blowing. He was 19 years old and he had cataracts.
Wow.
Right.
Will they reform?
No. Once per customer. Once that cataract is removed, it won't grow back. The cataract is in a shell, and what will happen though, that shell will start to lose its clarity. So sometimes 2, 3, 4 years down the road, you'll need to use a laser to polish that shell, to make an opening in that shell.
The reason I'm asking so many questions about this, first of all, I got you here, but number 2, a lady at my church was having cataract surgery this morning.
Oh, really?
Yeah.
Good.
Second time, so she's already had one eye done, so she's familiar with that.
Right.
Most of us are apprehensive about going in for anything where you got an ingrown toenail. That's a big deal.
Sure.
But when you start fooling around with the eyes, big time stuff.
You want to go to a surgeon who's experienced. I've been in ophthalmology for over 20 years.
Whatever that word y'all use.
Is ideal. The key is experience. You want someone who's done a lot of cataract surgery. But if you look at cataract surgery, the big picture, you have about a 98% chance of seeing better. Maybe 1 chance in 10,000 of going blind.
Yeah.
I mean, the
There's
odds
no
are
absolute sure things in life. Huh? I mean, really.
I mean, I could get hit by a car going across the street.
Here.
There's always a little bit of risk. But again, this is the beauty. I mean, just this past week, I did surgery on a lady who was blind, from the cataract. So, I mean, she can't see anyway. So there's only really one direction to go, and that's up.
Up, and she's going to be able to see.
Oh yeah, better than she has in years.
She may want to kiss you on the mouth.
She might. I have a jealous wife.
I'll tell you, that's all right. You have to understand about that.
That's right.
That must be the great joy. Somebody come in and they're fumbling around trying to find the chair.
That's right.
And when they leave,
it's a blessing. It is a true blessing.
Disease robs many people of their vision.
Right.
Macular degeneration. I hear people talk. I don't know anything about it.
Well, macular degeneration is where the retina starts to wear out over the years. And it's a very difficult disease because there's not much you can do to prevent it. There was an excellent study that came out in 2001 that showed that antioxidant vitamins, vitamin A, C, E, zinc, and copper, help slow down macular degeneration. So I would tell your audience that if they're not taking a good multivitamin, if they're over 65 and they're not taking a good multivitamin, they should start. Immediately. And then there are 2 forms of macular degeneration. There's the dry type and there's the wet type. And wet's just a polite way of saying bleeding. But there's some exciting new drugs developed over the last 5 years where if that bleeding starts, these drugs can be injected into the eye to stop that bleeding and shut that down and preserve vision. And that's been a real miracle. There have been a lot of folks, I started practice in 1991. There are a lot of folks who would come in and they would have this wet macular degeneration and they're going to go blind and there was just nothing you could do about it. And now,
you can preserve their vision for a while.
That's right. I have a gentleman, he's been dealing with this for at least 4 or 5 years now, and he can still see to drive. Back in 1991, he'd be legally blind.
Wow. Are there some new things Yeah, and the works for macular degeneration that you see out there.
Right.
That they're still
the
working on. They haven't got approved FDA, but it's still out there.
The most exciting thing, and this I almost am hesitant to talk about it because I almost don't believe it, but they're working on a retinal implant. And this gets really into the almost science fiction realm, but there's legitimate research being done on retinal implants to help restore these advanced macular degeneration cases.
Wow.
Yeah, it's exciting.
And something I read the article, and we'll get a story about it from time to time. It comes up every couple of 3 years, where someone's totally, absolutely blind, and they go in and they fit them with a camera-type device.
Right.
Do you see any hope of connecting a mechanical device, a camera or something, connecting it to the neurons,
right,
where you could, where the brain would use that to see? Is there any,
right,
is that beyond the pale?
No, it's not beyond the pale. I mean, we're not there yet. It's baby steps. Right. And so right now, with this retinal implant, the retinal implant is communicating with the nerve endings in the retina. Right. But we still need those nerve endings to communicate to the brain. And now the trick is how do you hardwire or interface into the brain? And I think it's just a matter of time. Well, should I say how old I am? Yeah. I'm 49 years old, and I plan on living to be at least 80, Lord willing. And I'm hopeful before I die, we'll see a camera-brain interface.
Well, they're doing so much with miniaturization now, microchips, and they're printing things now. They don't actually build them, they just print them. And you've got 3D printing out there now where you can just build things up. It's unbelievable what's going on.
Well, I remember a time and period where we didn't have cell phones. You know, when I was a child, we had one phone in our house. It was downstairs, and if someone called at 3 in the morning, you had to go downstairs.
No extension.
No extension. Now I can call, England from I-75. It's amazing. And you think about it, we take it for granted, but when you think about that, it makes one wonderful. You think about what does the future hold.
Yeah, if we don't destroy the planet. Right. There's a lot of good stuff out there. All right, now, if someone's interested in seeing you, first of all, you need to go see an ophthalmologist once a year. Depends on how old you are.
That's a good idea. I mean, if you're over 65.
It's part of it, like going, you go get a physical, you're not complete till you go see an ophthalmologist.
Right. Go see your local ophthalmologist, your local optometrist. Have a good eye physical, for lack of a better word.
Got to dilate that eye so they can see in there.
Dilation's important. It's just kind of like working on an automobile. You can't fix an engine if you don't raise the hood. Right. So I know it's a little uneasy to get your eyes dilated sometimes, but that's really important in my opinion.
You got to do it, yeah. Right. What do you recommend? How often, Dr. Price? Well,
at least once every year or two. If you come to see me and you're totally healthy, see in 2020, then I'm going to tell you to come back in a couple of years. If I see some early signs of macular degeneration, I'll ask you to come back in a year. If I see some glaucoma, maybe see every 4 to 6 months.
Is there any symptoms that we would recognize that might clue us that glaucoma or macular degeneration might be
right? The key things to look for are blurred vision, difficulties driving at night, difficulties with glare. You might find that you read easier with a 100-watt bulb than a 60-watt bulb. These are some clues that you're not functioning up to par.
Okay. What age do you, and of course children have to have an exam before they can get in school now. You have to have an eye exam. But after they do it, they don't go back.
Right.
How often, what about how early would you have a child's eyes examined, Dr. Ken?
The pediatricians, I think, do a very good job between birth and 2, birth and 3. There are some key things that you want to look for in that newborn baby, that 6-month-old. A 6-month-old can't read the eye chart. A 6-month-old, you have to go by the exterior signs that child gives you. I can do an eye exam on a 1-day-old, so there's no limit as to how young a person can be to have their eyes examined. But generally speaking, the pediatricians do a good job looking for those disease clues early on. So then, it's up to the parents, 2, 3, 4 years of age, it's a good idea to get your children's eyes checked. And certainly before they start school. I always hear the stories of where the child goes to school and the child doesn't perform well, and they think the child is
Yeah,
delayed or lazy, and well, he can't see.
Exactly.
You know, and how would you know? You know, because the child doesn't know what they're missing. I remember when I first got my eyeglasses. This is back when I was in the first, second grade. For the first time in my life, I could see leaves on the tree. I didn't know trees had leaves. Right. And I walk out, and I was awestruck. And now that I think about it, that's probably one of the reasons I became an eye doctor, because it was just, you know, seeing things I've never seen before. Right.
I love that. If someone wants to make an appointment with you, do they need a referral, or can they call the office?
No, they can call directly. Eyesight Associates here in Cordele, and you can, you know, check the directory for our phone number. Okay.
And our friends up in Warner Robins, Perry, Marshallville, Fort Valley.
Right. We have an office in Fort Valley, we have an office in Warner Robins, and we have an office here in Cordele. We also have a office in Fitzgerald.
Okay, you folks down in Fitzgerald watching.
Right.
So let me be sure. We have one in Fitzgerald, we have one in Cordele, we have one in Warner Robins, Fort Valley.
And that's 4 offices.
4 offices, okay. All right, we're in all 4 of those towns, so if you're watching today, do you go to all the offices, Dr. Price?
I go to Warner Robins, Fort Valley, and Cordele.
Okay, so he'll be in one of those 3 offices. You can go to the internet, look them up on the internet, Eyesight Associates.
Associates.com.
Okay, there's a phone number locally. You can call that number at 273-0435. That'll ring here in Cordele. You folks watching Warner Robins or Fort Valley or Fitzgerald, go to the internet or go to the local phone directory, and you'll find them there. Or you can call the Cordele office, and they'll tell you what the number is.
We're all one family.
Great. Brian, what a joy to have you. Will you come back to see me? I got about a zillion more questions.
Anytime.
I would love to ask
pleasure.
you. Thank you. Dr. Kent Price, he's an ophthalmologist, practices with Eyesight Associates. We will take a break.